Before I turn it over to Governor Sisolak and State Superintendent of Instruction, Joan Ebert, I wanted to provide a few general COVID-19 vaccine updates. As you may have seen this morning, the DHHS Office of Analytics made some important updates to our vaccination dashboard that can be found on the NV Health Response website. The COVID-19 vaccination page has been updated with additional data points to include race and ethnicity information. The dashboard will also be updated on Mondays, Wednesdays, and Fridays moving forward. We know this is important information for the public and appreciate the work of the Office of Analytics to continue to improve the dashboard. I also wanted to talk briefly about the ongoing work the state is engaging in with local health authorities and jurisdictions as it relates to equity in vaccine distribution. As you know, the team will provide updates to the COVID-19 Mitigation and Management Task Force on a consistent basis. But I wanted to provide a brief update on what we've done so far. We are currently working closely with Clark County to provide additional support to reach this shared goal. We appreciate their partnership thus far. And while we are currently very involved with Clark, we continue to support equitable distribution with every Nevada county. We understand the challenges our seniors are facing, and we're developing opportunities to serve Nevada seniors who may be homebound or have mobility barriers. We have suggested mobile strike teams to meet these residents where they are, and we are able to gain additional guidance from the Centers for Disease Control and Prevention about transporting punctured vials in order to support this delivery mechanism. Also, the addition of the statewide call center has enabled those eligible for vaccination, but who may be experiencing a barrier for internet access, to receive information and assistance over the telephone. The call center is able to utilize multiple languages, which supports equitable access to information. We are making gains every day, and I am really proud of the partnerships we have and the dedication of those in the field to make every effort to support an equitable distribution. We will continue to evaluate progress and use the Nevada Vaccine Equity Collaborative run by Immunize Nevada that will have its first meeting next week to help inform vaccinators on tailored messaging and outreach, as well as community-based support across the state by those who work within equity day to day. As race and ethnicity data is received and then published, we will support counties in providing context to the data while evaluating outreach efforts and any challenges experienced to address vaccine confidence or access issues. Earlier this week, we mentioned that some vaccine deliveries may be delayed in arriving this week due to severe storms across the country. Our team is continuing to monitor this closely, and we are working with health districts and pharmacies that may be affected. We ask Nevadans to continue to be patient at this time, as some events will need to be rescheduled. Doses of vaccine are allocated on a weekly basis, and we encourage Nevadans to go to nvcovidfighter.org for appointment availability. At this time, I will turn it over to Governor Sisolak, who has additional exciting updates about our vaccine efforts.
Good afternoon. Thank you to Caleb and Candace for letting Superintendent Joan Ebert and I join you this afternoon to provide a few important updates. And thank you, Candace and your team, for continuing to work with federal and local partners to help manage Nevada's vaccination efforts while keeping an eye on equity. I want to start by providing some other important updates to our state vaccination program. We know that COVID-19 continues to impact older Nevadans at higher rates, and I'm pleased to announce that beginning next week, more of these Nevadans will be eligible for the vaccine. Some of Nevada's counties have already started vaccinating those 65 and older, but some of our larger counties have not. Beginning next week, the state will be opening immunization opportunities to Nevadans 65 and older through the Federal Pharmacy Partnership Program in all counties. We were able to do this because of the increases in allocation of vaccines to these pharmacy programs from the Biden-Harris administration. I am grateful to the administration for continuing to work collaboratively with states to ensure we are increasing the supply of vaccinations available. Due to continued limited allocations and the shipments of the vaccines, only the pharmacy partners enrolled in the Federal Pharmacy Partnership Program will be offering vaccines to those 65 plus beginning next week, unless your county has already begun vaccinating those 65 and older in the community. These pharmacy partners will begin to schedule these appointments next week, after shipments of the COVID vaccine are received. This is great news, but I know everyone is eager to expand to 65 and older across the state at all vaccination sites. That's why it is my hope, and it is a goal I have set for the state team, that we can work with counties who have not yet been able to offer the vaccines to this age group to ensure they can expand vaccination events statewide for the 65 and older population by March 1st. Again, some of our small counties have already been able to offer vaccines to those 65 and older, but this effort will help some of our larger counties move into this category faster. While we welcome the news that federal pharmacy program has been allocated an increase in doses from the federal government compared to the first week of the program, we know it will not be enough to cover the range of Nevadans in this age group. We continue to ask Nevadans to be patient as we await increased allocations from the federal government. So again, if you are 65 and older or have a loved one who is 65 and older, opportunities will be available to schedule an appointment at one of Nevada's pharmacy partners beginning next week. nvcovidfighter.org will have additional information on how and where to schedule those appointments. Nevadans who do not have reliable internet access or need help can reach out to the statewide call center at 1-800-401-0946. That's 1-800-401-0946. Additionally, I wanted to provide some important updates related to Nevada schools and high school sports. As you all know, getting students back into classrooms as safely as possible is one of the top priorities that I laid out in my State of the State address last month. This afternoon, after this call, my office will be releasing a new emergency directive and related guidance documents that will provide county school districts the flexibility to help bring more students back into the classroom safely. But the reality is that in order to get our students back in the classroom and keep them there, it's going to take every Nevadan to make these students a priority. We know from the CDC that reopening schools can be done safely when communities implement and strictly adhere to proven mitigation measures. Our transmission rates are on the decline. In order to continue getting more children back to in-person learning, it's critical that all Nevadans do all they can to help keep the rates low. When you make the safe choices to practice social distancing and wear a mask and washing your hands, you're doing it for our kids, our educators, and our families. Before I turn it over to Superintendent Ebert, I have one more announcement that will impact Nevada students, and I know they've been waiting for this. As you all know, up until today, full contact sports have been prohibited. I know this has been difficult for many of our student athletes and their families across the state. We've been working hard to develop a plan for how we can allow these athletic activities while still keeping our students and adults as safe as possible. I'm excited to announce today that under this new emergency directive, full contact sports regulated and governed by the Nevada Interscholastic Activities Association, the NIAA, may resume practice and competitions if social distancing and all new requirements can be met. In order to allow NIAA-regulated full contact sports to take place, the NIAA must develop a mandatory COVID-19 testing and mitigation plan that then must be adopted and followed by each school district and school intending to allow full contact sports. A plan must require at a minimum weekly testing of coaches, staff, and athletes participating in these sports. Prior to the start of the full contact sport competitions between schools, the local school districts or county school superintendent must approve the commencement of the particular full contact sport, including agreement to implement the NIAA testing and mitigation plan. Spectators will be allowed to attend all NIA sporting events subject to the applicable limitations set forth in the recent gathering directive. Host schools will be responsible for ensuring compliance with applicable gathering and event guidelines, capacity limitations, and protocols. Resumption of full contact sports only applies to those regulated and governed by the NIAA. Full contact sports, games, and competitions remain prohibited for travel and club leagues, private leagues, park district sports programs, and similar non-NIAA sports leagues at this time. We are taking the step of allowing full contact sports to resume competitions for NIAA only because they are able to be highly regulated and overseen by our school districts, including the regular testing requirements. On May 1st, 2021, we hope to transfer these decisions to local authorities. As a reminder, all other non-contact and minimal contact sports, including baseball and soccer, have been allowed to hold practices and competitions since October. Last week, we allowed tournaments for all of these allowed sports beginning March 15th. There will be full guidance sent shortly after this press conference. I will now turn it over to Superintendent Joan Ebert to discuss the new Education Directive more in depth.
Thank you. Good afternoon, everyone. Thank you, Governor Sisolak, for putting education and our children first. I'm really excited that the new directive will allow school districts who have already been offering in-person instruction to some or all of their students for at least 20 days. The new directive will allow them to increase the occupancy capacity to 75% or a maximum of 250 people in a contained space while maintaining other safety measures such as mandatory masks and social distancing. We will also be increasing the capacity limits on our school buses to 66%, again, with mask requirements and social distancing in place. This will make sure that the difference that we're doing and the many things that all of our school districts are participating in and transporting our children to in-person instruction is at the top of mind. I want to take a moment to recognize and thank our district superintendents, our school leaders, educators, professional staff, the students and your families for all of the amazing work and the perseverance through this challenging time. Thank you to our communities working together to prioritize health and safety. I especially want to note our partners in DHHS, the social emotional supports for our students and staff. We can continue this movement to get all of our children back into our classrooms, making sure they have equitable access to high quality learning opportunities each and every day. It's been an amazing ride as we've been through all of this. And I want to thank the community for bringing these numbers down so that our children can have in-person learning. We have our largest school district, 320,000 students on March 1st, who will be going back PK3, going back into in-person learning by choice. Parents are allowed to make those choices, whether it's in person or at a distance. And the other 16 school districts have had that choice since school has opened, and their work has been phenomenal. But I call upon all of our community members, as the governor has, to continue keeping these safety measures in place so that our students can participate in in-person learning. We have over 500,000 children in our state that we serve, and we want to make sure that they're on a path to success and that they're engaged with their teachers in in-person learning. Thank you, Governor. I know we have some questions coming up, and the staff will be managing those.
Thank you, Superintendent Ebert. Sorry, Governor. Thank you, Superintendent Ebert, Governor Sisolak, and Candace for providing those updates. We will now move into a short Q&A today. I see lots of folks are already raising their hands, so I appreciate you all doing that. We'll start with Sam Metz from the AP. So Sam, if you'd like to unmute, and then you can ask your question.
Hi, Governor. Thank you so much for doing this and taking my question. So Administration officials and federal agencies like the CDC have said that vaccines for teachers shouldn't be a prerequisite for reopening. To keep it as a simple yes/no, do you agree? And if we're letting conventions, malls, and restaurants accept hundreds more people in March, is it a problem if Clark County doesn't come up with a more concrete plan to return fourth grade and above to classrooms?
Well, it's my hope, and I'll let Joan respond as well. It's my hope that we can get more kids in classrooms as quickly as possible. I feel it's extremely important. It's not just a yes or no answer. I know that they have allocated or given the states this responsibility. I think it's important that teachers have vaccines available to them. We have made it available to the teachers. I hope they take advantage of that, and I hope that we can get 4 through 12 in the classrooms quickly. Joan, you want to add?
Thank you, Governor. Yes, so 16 of the 17 school districts, as well as the state public charter school authority, have had our educators in classrooms since August. And so what's wonderful about this time is that we do have the vaccines. We continue to learn and move forward and get our children back into face-to-face learning.
Thank you, Governor. Thank you.
I just want to add there, Sam, that Superintendent Ebert has done a remarkable job. And in 16 of the 17 counties, we're way ahead of the 17th county, which is Clark, which is the biggest one. And we're hoping that Clark can catch up quickly and we can get these kids all back in the classrooms.
Thank you, Governor. Thanks, Sam. Thank you, Superintendent Ebert. I had David from Channel 8 as the next hand that I saw.
Thank you, and thank you, Governor, for taking our questions today. Today, Nevada ranks again near last on the distribution on the vaccine and the number of arms that this vaccine has gone into in terms of state population. I know this is something you've been talking about, been working on with the White House. And on top of that, we had news today from the Southern Nevada Health District that the weather has delayed shipment of the Moderna vaccine, so they're only offering second doses next week. So I was hoping you could provide some information about your contacts with the White House or the Biden administration and the CDC on ramping up getting doses in. I know you had said a couple weeks ago, I have the people, we just need the doses. And then also talking a bit about these delays and how it's affecting now getting this next group of people eligible. Thank you.
Thanks, David. Governor, I don't know if you want to let Candace maybe answer that question.
Sure, Candace can start and then I'll wrap it up. That'd be fine.
Yeah, thank you, Governor. So, yeah, thank you, David, for the question. I'll address the weather first. You know, unfortunately, that's something that's just out of our control. And so we are supporting as much communication that comes from the CDC as possible in terms of when that will happen and immediately get that information to our partners who will then be able to really support those rescheduling appointments for those in, you know, across the state. In terms of our allocation, and what we've been able to administer, every single county has done a tremendous job of actually administering the doses that they've received. That's incredibly high. They've done such a phenomenal job scaling up, being able to really use the doses that they received within a week's time. So, you know, outside of looking at the rate per 100,000, I have to say that the actual capacity of these partners is tremendous, and they're doing a wonderful job at actually vaccinating individuals in this state.
And I'd just like to add to that, we're continuing to expand the folks that are eligible for the vaccine. That's why we're going to 65 plus next week and March 1st for all the folks, even not the pharmacy partners. But I was on the phone with the White House task force yesterday. We are continuing to ask for more doses, and we're getting the vaccines that we get into people's arms. The health districts are doing a good job. They've already said that they've got problems with people that are, you know, double booking appointments and people that don't show up and whatnot, but no vaccines are going to waste. We're getting put in people's arms.
Thank you, Candace. Thank you, Governor, and thank you, David, for the question. I have Megan Messerly as the next question on the list. Megan?
Thanks again for doing this. This is probably a question for Candace, But according to the CDC's website, Walmart is the only retail pharmacy chain that's participating in the Federal Retail Pharmacy Partnership Program in Nevada. One, is that correct? And two, if so, am I correct in understanding that means that those 65 and up will only be able to start receiving vaccines at a Walmart next week, unless, of course, their county's already begun to vaccinate that population? And then as a third question, is someone able to cross county lines to drive to a Walmart if they don't have a Walmart in their county?
Thank you, Megan. This is Candace McDaniel. So we are actually supporting and with some of the state allocation on top of what the federal retail pharmacy allocation is. So right now we still have this this bridge program that I know we've talked about previously, where we are sharing some of the state allocation with some of our pharmacy partners. But then this additional federal allocation on top of our state allocation is going to Walmart. So to support, the exciting news that the governor was able to just provide about the 65 and older, all of the pharmacies will be able to provide vaccination for the 65 and older population beginning next week. In terms of the, the county lines, I think that we've done our best. So even if there is not a Walmart in a county, we have, with the help of the Board of Pharmacy, have actually been able to approach other pharmacies within those counties who can also be providers. So even though it may not be a Walmart, we have done our best with the Board of Pharmacy to provide that pharmacy route in every county. So they will also be included.
Thank you, Megan. Thank you, Candace. We'll go to Bert. Bert, if you could identify yourself and what outlet you're with, please.
Yes, of course, and thank you for taking my question. This is Bert Johnson with Nevada Public Radio, and I wanted to ask about the county level demographic data as to who's been receiving vaccinations. I see on the state dashboard that it appears to only have demographic info for statewide vaccinations. And just curious if there are plans moving forward to disaggregate that into the individual counties. And a second part to my question is the equity initiative that was announced earlier this month, specifically referenced Clark County and Southern Nevada Health District. Will that be expanded? Is there a need to expand that to other counties in the state?
Thanks. Candace, do you want to? Go ahead, Candace. I'm sorry.
Thank you, Megan. That's okay. Thank you, Bert. So the county level distribution, if you actually use the dashboard that's on the Nevada Health Response website, you're able to actually dive into some county. If you just click on those particular counties, you'll be able to dive into some of the deeper data specific to that county. In terms of the equity, yes, we definitely are working very closely with Clark County, but we are continuing to have and reinforce and support a lot of that equity conversation capacity practice with all of our counties. So it's not that our other counties are not working towards this, they absolutely are. We just know that the majority of our population is in Clark County, and so we're really just supporting a lot of their data needs at this point.
Thanks for the question. Thank you, Candace. I have a few folks from the RJ. We'll start with Jason Ort, who I believe is a sports reporter from the RJ. If you're able to unmute yourself and ask a question.
Hi, thanks for taking my question. And this is for anybody who would like to answer. Obviously, high school football is a season that's coming up very soon, and I guess today's announcement removes it from the ban, I guess, on full contact sports. So, just how was that able to happen now? What were some of the key metrics that you were looking at there to make sure that it could be played safely?
We're looking at the drop in the positivity rate, the drop in the number of cases. A lot of the kids, and I fully understand, they want to get back on the field, they want to get practice in, they want to have their games. Some of these students are hoping for scholarships to move on to college. We're going in the right direction, and we decided that it was time. Now it's up to the local districts. Clark County, I don't know if they're going to participate. That'll be up to them. But there's been a lot of demand in Washoe and the rural counties to allow us to go forward.
Thanks, Governor. Sorry, thank you, Governor. Thanks, Jason, for that question. We'll go to Mary Hines, the health reporter from the RJ next.
Thank you, and good afternoon. Supplies of vaccine remain limited. What is your estimate of how many people across the state in the age group 65 to 69 will be able to get the vaccine on a weekly basis? And how long do you believe it will take to get everyone in this age group vaccinated who wishes to be vaccinated?
Thanks, Mary. Candace, would you like to start with that question?
Absolutely. Thank you, Mary. I know that we've talked about, the difficulty in trying to project how quickly or the pace of which we are able to get through a particular population. It very much varies from county to county, what their throughput capacity is, et cetera. I think that it's also, as we've sort of seen over the last couple of weeks, we do really hope that, in the future, we are just only increasing that allocation that we're be able to get from the federal government. So if we continue to see an increased allocation, I think that we'll be able to provide these opportunities to that age group, as we move through. So, as we've mentioned before, it's really difficult to sort of put a timeline on that, but I think it's very encouraging to see that, the federal government and the Biden administration has really supported trying to increase the allocation for all states, but it's really important here in Nevada. It really helps us support just an increase in access. So unfortunately, it's really difficult to give you an exact timeline.
We do have some good things on the horizon, Megan, if I could. The Johnson & Johnson vaccine hopefully will be coming forward in the near future. Moderna was approved to put 14 doses in their vials now, which should help the finish and fill aspect of that, get more doses shipped out to the various states. So there are good things on the horizon. And as Candace said, we'll just have to wait and see how quickly we can get our supply, our allocation increased.
Thank you, Governor. Thanks, Candace. Thanks for the question. We'll do Orko and then Michael Scott, and then we'll probably pull to a close for today, and we can circle back with anyone we don't get to.
Hi there, Governor. Thank you so much for taking our questions. First, I just wanted to ask, with the NIAA regulated sports, when it comes to that weekly testing and mitigation that you had talked about, how exactly is that going to be monitored, and I guess what kind of system is in place for that?
So if I may, Governor, I know that NIAA will be promulgating some regulations and guidance around this. So Orko, you'll be able to find some more information once that happens. But Governor, if you have anything to add before we go to the next question on that one?
No, yeah, it's my hope and our desire as a state to get these kids back on the fields, but in a safe manner. And our team came up with some protocols that I think are very reasonable, be helpful to everybody, the weekly testing and the social distancing, the mitigation protocols, and in conjunction with Joan and the NIAA and the parents of the kids, they want this to work too. I think everybody's on the same page. So I'm confident that we're going to come up with a plan that will be very beneficial for all.
Thank you. And I'm sorry, Superintendent Ebert, were you trying to speak earlier and I cut you off? I apologize.
No, I think so yes, I guess I will add to what the governor said. The NIAA regulations will come out, but it's important to note that the DHHS, the Department of Education, NIAA, everyone has come together to make sure that the proper testing is in place so that these students have access to athletics. And it's been a real team effort to get this launched, to make sure we can move in this positive direction. And so I'd look for that specific guidance in your question will be coming out shortly.
Thank you, Superintendent Ebert. And we'll close with Michael Scott from the RJ, and we will loop back on any of the hands that are still raised after we're done here. So Scott, you can take the last bite at the apple.
Thank you, and good afternoon, everyone. Candace, I believe this question would be best directed to you, but anyone is open to answer it or chime in if they'd like. So Nevada is currently working to roll out a statewide vaccine appointment system through Salesforce. And I just had three quick questions about that. First would be, is this going to be, this new statewide system, will it be mandatory for local governments to switch over to this system, since we've seen them using, different municipalities using their own systems? Is it going to be mandatory for everyone to move into this unified system? Second, what does the state think the benefits of a unified system will hold versus the current multitude of systems we have in place currently? And then finally, I've heard some concerns from local government officials about that they haven't had a chance to see the Salesforce system yet, see how it operates, and the amount of training time that they'll have with it before being asked to implement it is not very long. And I just kind of wanted your thoughts on that. Is this a system that you believe that they'll be able to pick up extremely quickly and be able to hit the ground running with in a matter of days or just a week or so?
There are a lot of questions in there. Candace, do you want to try to answer a little bit there before we end?
Megan, this is Julia. I can take that too if you want.
Yeah, yeah, please go ahead, Julie.
Okay, so Julie Peak, also DHHS. It is a voluntary system. The state purchased it and can be used by anyone. Our initial rollout is going to be in Clark County. We're going to provide more details on that starting next week. The benefits to such a system, we're doing a lot of project management on our end to make sure that it is rolled out timely. It has a good deal of oversight. We can provide training opportunities and train the trainer opportunities. And so our team is doing a lot at DHHS for that. The benefits of the system as well is that our call center will be able to book and change and cancel appointments really easily. They're getting trained on that system and will be ready for go live in the coming weeks. As far as to see how it operates prior to using it, our team throughout the COVID response, I have to call out our IT specialists, have been moving at the speed of light. We wanted to get this tool up before March, and our team has done that. We'll certainly be making changes as we move along with the system, but there is, we also had feedback from the locals that they don't want to get trained on a system and implement a month later, because all of us have challenges remembering how to use the system after a month. So we are doing training opportunities a few days prior to the launch, and then again, we'll have training opportunities throughout implementation. Thanks, Megan.
Thank you.
Thanks, Julia, and thank you everyone for joining us today. I think there were a couple folks that maybe we didn't get questions in, so if you want to circle back with me, we'll try to help answer those. We'll also, as the governor said, have additional guidance coming forward. So thank you all for joining us today. Have a great rest of your afternoon, and we'll talk to you all soon.